It's great to be here today at the Wessex Centre of Excellence Data and Analytics event with so many people from so many different walks of life, from so many different organisations, all who have a common interest around data and analytics and how we can use that to better support the populations that we look after and care for in the NHS, local authorities and wider organisations as well. It's been fantastic to see people come together for the first time for more than 2 years and to watch them share experiences they've had of the last 2 years during the pandemic, and to listen to some of the ways they're hoping to see the profession of analytics and intelligence advance into the future. It's going to remain core to the way our organisations have to work and respond. So it's really important that this sort of self-organised group continues to remain strong and continues to encourage and support each other.
I think we're a very inclusive community. We want to make sure that we're including colleagues from within the healthcare services, both across Dorset, but across Wessex into Hampshire, but also to try to start to include people from beyond just healthcare, local authority partners, people from voluntary sectors, fire, police, etc. So I think the idea that we can be an inclusive community of analysts and analytical professionals can help support one another.
It's been really nice to impart some of the wisdom that I've gained through blood, sweat and tears over the last 5 years, and just meeting all these other analysts that are also keen to progress and move past being little hermit crabs in offices and just trying to really improve everything and make it better for the surrounding area. But it's just really nice to see that the analysts are starting to come out more and that people are really keen for analytical improvement, because for so many years there was almost no training budget and no real move for like career progression or anything. Analysts just did a job that helped people sort of maybe, but it wasn't really always a very appreciated role. So it's just really promising to see areas that this is now being much more appreciated, that people are working together, wanting to share stuff. There's been some talk of open source, which is something that me and my team are really big on as R users, more than Python, don't really understand Python, but using R that can be all open sourced is brilliant.
I'm here today at the Centre of Excellence event really to just learn from others. I guess what I think is fantastic about the event is you just pick up so much knowledge, just learning about little tips and tricks, the way other people are doing things. I guess in some ways sharing frustrations that we all have as well, and kind of what other people are trying to do to get around those, and yeah, just really learning from others and getting to connect with everybody. I really liked the talk actually that David at Dorset did in terms of looking at the culture, because I think so much of what people think about analysts is very kind of dry, and it's all about just looking at data and doing coding and things like that, and actually it's all meaningless if you can't actually communicate that to an operational clinician. We're doing some work at Southern Health at the moment to kind of revamp the way we deliver analysis to our operational and clinical staff, and I think that's just so important, is being able to translate that into something that people can turn into a kind of actionable insight.
So what I really like about being here today is the opportunity to meet in person and have probably more in-depth and relational conversations with people about my work, about how we can turn those data insights into actions and hopefully improve the outcomes for the people in our communities. So I think there's a really nice vibe in the room today, loads of positivity and lots of people who are willing and able to do something different and influence from senior decisions right down to the people level, how we can improve population health and make a difference for people in our communities.
Well, I think, we need data and information and intelligence in the NHS and in the health and care system as a whole. And we need people who are excellent at providing us with that data, information, intelligence and insights. And this kind of centre really helps to provide them opportunities for training, to bring people together as a community and to really motivate people to deliver that in the best way that we can, and at the forefront of kind of innovation and taking it to that next level as well.
So I'm really excited. It's lovely to see everybody back again after 2 years of everything being virtual, and it's just great seeing everybody networking, meeting new people, hearing about all of their stories, everything that they're getting involved in, and how this kind of event can support their development into the future. I think for me it's a really great opportunity, particularly for people to learn from each other and to make new connections. So we've talked a lot today about career development, mentoring, kind of learning, side-to-side learning, that kind of stuff. And I think there's definitely the power in people coming together and learning from each other. It's quite inspiring, I think, to actually come to this kind of event. You go away kind of thinking of all these ideas of, the things that you want to implement in the future.
I think it's been a really nice chance to reconnect with people that maybe I haven't seen for a while. It's great to talk to other people who are really excited about analysis and data. You can't always get to discuss that with other people. It's a bit like a big analytical family, so obviously I've got people within my team who know lots of, I can go to and ask questions and things, but this is just like an extended family that you can go and ask, whether it's you're working on a project or you want some input into a type of analysis you might want to do. You can just bounce ideas off of other people, which is really helpful rather than just internal to my organisation.
It's really important to learn from our other colleagues in other trusts or in public health and wider than just UHS as an organisation. So it's fantastic to come together, hear some of the common problems and hear some of the solutions that some of our colleagues are coming up with. It's been really great hearing everyone's different opinions and thoughts and how they're approaching things and some of the really innovative approaches which people are coming up with, especially the things which they're doing to engage their teams. Really important that we keep our teams engaged and that we find ways of developing them, which isn't just all about paying them a little bit more, but finding ways of building a community and building a series of tools which they can tap into.
I think it's really great to be part of a larger community. I think it would be really easy to kind of work in our different organisations, but actually it feels like you can achieve more collectively, and it's really great to have a forum to talk about some of the new technology and the new things that we're trying to do and how we take the learning that we've learned over the last few years forward and continue developing. It's been really great to hear the really wide range of talks that we've had, from really technical software through to well-being, which is totally important as well. So it's really kind of sparked that thinking again, and just being in a room with people. It's just great to feel that energy and have communication with people.
In general, I think we're slowly influencing now sort of those decision makers, both political and the senior leadership teams within the organisations, to be data-led and have the evidence to make those difficult decisions, and really to understand what are the priorities that we need to deliver against. And the most important thing is we're delivering better services, better healthcare to the residents of Dorset. The AnalystX presentation was really insightful. I think there's huge opportunities, especially when you look at process mining, machine learning, artificial intelligence. But I think it's important that actually we need to get back to the basics, doing the basics well before we can start to build on our success.
So for me, I think the idea of a tech community is really powerful. Getting like-minded people in a room, sharing ideas, coming up with great concepts, talking just about the things that they're up to. I don't think there's any better way to evangelise what's great about technology. So, I think there's huge power in coming together.
So today I'm speaking about retaining talent and attracting talent during the Great Resignation. Particularly relevant because it's not about money, it's about community, values and collaboration, it's about people. So it is fantastic to see people coming together, especially post-COVID, and to see us collaborate, to see us share ideas, inspire each other. We all have a shared love of data, a shared passion for what we do, to support patients, support the public. To be able to do that as a group, as a community, makes us stronger. And to see us doing that in person again, it's really fantastic and energising. I think the thing that excites me the most about today, unfortunately, as a presenter, isn't the people presenting. It's the ability to connect with people, the ability to talk to people, to share experiences and to learn from others. And I think that there's tremendous value in that, and we shouldn't underestimate that as we come back together as a group for the first time.